you know much about the procedure?
I just know something about slicing in a circle and bringing the flap back and then putting it back.
All right.
LASIK surgery, short and simple, corrects nearsightedness, farsightedness, and astigmatism. It is generally painless. We use the numbing drops like they use to check your pressure,
Yep.
to keep your eye sort of calm. And we use eyelid immobilizers to hold your lids open so that you can't blink.
Yeah.
The first laser, the femtosecond laser, is placed, you're placed underneath it. The suction cup adheres to your eye and it creates a surgical flap by using gas energy to separate a thin layer of tissue about 260 degrees around. Think of a pancake that if you were to try and open it would have a hinge at the top, okay? After about 10 or 15 minutes, we take you into a second laser room, and that's where the actual vision correction is done. The doctor uses a prong to separate the tissue, fold it open, and then he hydrates it. He makes sure it's nice and clean, and he uses the laser for anywhere from 10 to 30 seconds to correct however much visual deficit you have. Because you're nearsighted, the center area is usually flattened out just a little bit to make sure that the light goes where it needs to go.
Cool.
When he's done, the little flap goes back over, it's smoothed out, they make sure that it's lined up nice and appropriately, and that's it. Altogether, the time spent from the time you walk in the door to the time you leave the facility is usually around an hour. And then you go home and you rest. So basically what we're going to do today is decide what kind of surgery you're going to have. And the way we do that is we're going to use a couple of machines to figure out the thickness of your cornea, the prescription in your vision, and ultimately what is the best surgical option for you, be that flap LASIK or PRK, which is just surface treatment. So we'll do the tests. I will do a traditional workup for an eye exam. You'll have a refraction test done by the doctor. You'll meet with Dr. Spector, who's the surgeon, and he will tell you, based on all of that evidence, what your best plan is. Next, who can have LASIK? Generally speaking, it's patients who are 18 years of age or older, which you are. You should be free of certain eye diseases, which include keratoconus, certain types of cataracts, and then retina or optic nerve diseases. Part of the screening that we went through today was to make sure that you didn't have any of these diseases, and you don't. You should also be free of active viral infections, which include herpes simplex and herpes zoster. Those are the two most common that people tend to have, and again, not you. You should also be free of certain systemic health conditions, including uncontrolled diabetes or any illness or medication that would render a patient immunocompromised. The last thing we would want to do is subject you to a surgery to correct vision that may be impacted by a medical problem and not actual bad vision. And then lastly, are you pregnant or planning to become pregnant? What is sort of your end game? What is the goal for you with LASIK?
To just have like a life free of contacts and like free of having to deal with like the pain of that.
What kind of activities? I mean, you work, you perform, you have friends, you have a social life. What kind of stuff is being impacted by the fact that you can't see well?
I find it most annoying when I wake up in the morning and I just can't see.
Okay.
And especially if like I left my glasses in the bathroom, then I have to get up and like find my way to the bathroom. Not that I'm blind, but like I have to find my way to the bathroom to get my glasses in order for me to see anything.
Okay.
I hate wearing contacts. It's like when I get home, especially like after a show or something, and I have to deal with the pain of contacts and like putting them in the solution before I had dailies.
Okay.
And dealing with that. It's just like a nuisance and it's irritating and like I just want to be able to see.
Absolutely.
Go off the clump.
A little.
Stop wearing your contact lenses on July 13th.
Okay.
And when I say stop wearing them, I mean forever. Are you excited?
I'm so excited. I'm nervous, but I'm excited.